Aditi Nerurkar now. She's a physician at the Harvard Medical School. Dr. Nerurkar, I want to ask you first to weigh in on what we're seeing happen in Georgia. What do you think are the implications of a major vaccination slowdown as we try to fight this pandemic right now in that state in particular?
That's a great question, Aaron. You know, right now with the mass vaccination sites in Georgia closing as of May, they've vaccinated only 5% of all vaccinated Georgians. So it's a very low demand. They're hoping to move into more community-based outreach and grassroots efforts to bring vaccine to where the people are and make it as easy as possible for them. The next stage of vaccine administration in Georgia is going to be focusing on vaccine equity. Folks like Stacey Abrams and others have committed to bringing vaccine to more people, removing barriers like geographic barriers, political barriers, like Morgan was saying, religious barriers, and economic barriers. The real goal is to improve vaccine education, improve vaccine access, and decrease barriers, with the bottom line of getting as many Georgians vaccinated as possible.
Let's talk a little bit about some new info from the CDC this morning. It talks about a small number of anxiety-related events reported by some people immediately after getting the Johnson & Johnson vaccine in particular. Can you talk about what's happening here and what folks might be able to do about it?
Yes, so about 67 cases have been reported out of the 7 million doses of Johnson & Johnson vaccine administered. The key here is that when there are events like anxiety-based syncope. Syncope is a fancy word for fainting. So what's key here is that the vaccine doesn't cause fainting. Rather, the stress from the vaccine causes fainting. And we think it might be due to two reasons. The first is that these folks may be needle hesitant. They are opting for one shot rather than two. Yeah. And the second is that there was a recent pause, so there may be more anxiety. The key here is to talk to your physician, enroll in the CDC V-Safe program, and to remember that if an event happens after vaccination, it's not necessarily due to the vaccination itself.
And take a few deep breaths before you get that shot, it seems, too. Dr. Aditi Nerurkar, we appreciate your time today. Thank you.